Motions General Notices, number 1648. Minister for Women, standing in the name of the member for Newtown.
I call the member for Newtown.
Thank you, Mr. Speaker. I move that this House, 1, supports the right of women to make choices about their individual reproductive health, 2, acknowledges the widespread community support for a woman's right to choose, 3, notes that the Minister for Women stated she is pro-life, 4, expresses concern that women in New South Wales could be represented by a Minister for Women who is anti-choice, and 5, calls on the Minister for Women to clarify her position and confirm her commitment to defend and protect the rights of all women in New South Wales to reproductive freedom. Women should have the right to make reproductive choices for themselves. Our laws and the policies of the government should not restrict or prevent a woman's right to choose. It is absolutely shameful that here in New South Wales abortion is still in the Crimes Act. That in this state we are part of the problem which criminalises the act of women and people making reproductive choices about their own bodies and their own lives. I wish to recognise that this issue also impacts on transgender and gender diverse peoples, and that we need to ensure that the basic human rights to ensure that all people have the access to safe, legal reproductive choices is realised. As many of you will know, my colleague in the other place, Greens MP Dr Marine Faruqi, introduced a bill to remove abortion from the Crimes Act in New South Wales. This was the first time that this issue was debated in the New South Wales Parliament in its 100-year history. 100 years ago, it should be noted that this Parliament was made up of only men. Women didn't even have the right to vote, let alone to sit in this chamber and debate whether or not they should have the right to make decisions about their own bodies and about reproductive health. Unfortunately, not enough has changed in those 100 years, and women still don't have representation in this place at equal numbers, and a woman's right to choose to have an abortion is still criminalised in our law. It is shameful that a majority of members in that other place defeated the bill to try and remove abortion from the Crimes Act. The fact that it was defeated 25 to 14 just demonstrates how out of touch some of our elected representatives are to the overwhelming public support for the fact that a woman should have the right to access safe and legal abortions. Tasmania, Victoria, the ACT have all decriminalised abortion. People living in rural areas are even more strongly in supportive of this change. 1 in 3 Australian women have had a termination, regardless of what the law in this state says. This is an issue that personally touches the lives of thousands and thousands of women. As I know, and as any of the people who can tell you who have experienced this in their lives, it is a difficult and emotional decision to make, not one that anyone would take lightly. And it is certainly not made easier if there are offensive individuals standing outside of termination clinics harassing women when they're engaging in this very emotional and very challenging choice. And that's where we come to the motion we are debating today. The comments by the Minister for Women when she first took up this role, that she is personally pro-life, is of serious concern. The thing that should be considered here is not what the Minister for Women would personally do. What I would choose to do, what any woman in this place would choose to do, is not the business of this chamber. However, it is the business of this chamber to ensure that every woman, when she finds herself in a situation where she may be considering a termination, that we empower that woman to make that choice about what is best for her. That is our responsibility in this place. Not to tell me, not to tell the Minister for Women, not to tell any woman in this place or in this state what they should do, but rather empower them to be able to make the choice so that they can access safe and legal reproductive choices for what works best for them. That is why I urge the Minister for Women to clarify her position and come out today to say that she supports the choice of all women in this state to be able to make the decision that they need to make for themselves, and recognises that it is not for us to impose a choice on them, it is for those individual women to make that choice. That is what it means to support a woman's right to choose. We in this place should empower women to be able to make this choice. Decriminalising abortion will not force anybody to have an abortion. Decriminalising abortion and expressing this House's support for a pro-choice position simply says that we believe that this very personal, very difficult choice should be put in the hands of the person who it impacts and who is affected by it, and not by anyone else in this place, and that is why I urge all members to support this motion.
I'd like to thank the member for Newtown. I call the member for Port Macquarie.
Thank you, Mr Temporary Speaker, and can I thank the member actually for bringing this motion to the House, because it will provide an opportunity for the Minister for Women, who is in the chamber today, to make very clear her position, which she has done previously. Mr Temporary Speaker, let me begin by stating that this notice of motion is in fact blatantly inaccurate in its portrayal of the Minister for Women's views. The Minister's views have already been made very clear, but as I said, this will provide yet another opportunity for her to do that, and this motion, as it is worded, misrepresents those views. However, there is no need to take my word for it. Can I refer the House to an article published on the ABC website on the 11th of May 2017 by Kathleen Calderwood. In that article, the Minister is quoted as saying, and I quote, "The decision to seek a termination is an incredibly difficult and deeply personal one." She goes on further to say, and I quote, "I respect and support a woman's rights to choose a path that is best for her," unquote. Let the record reflect that the Minister does support the right of women to make choices about their individual reproductive health. Mr Temporary Speaker, this puts this matter conclusively to rest. But now let me turn to the other issue, which is also a part of this motion, which is reproductive health. Mr Temporary Speaker, no discussion about reproductive health could be considered without also discussing women's health more generally. Women's health and women's reproductive health have a long history of being contentious. We all know that. From in vitro fertilisation to contraception, many of the choices women have made about our health have garnered a lot of public attention. And I acknowledge that there is an enormous diversity of opinion with respect to the many aspects of women's reproductive health. But no matter what your views, it is paramount that we provide the right supports and services to ensure that women don't feel like they have to go through an emotional and potentially life-changing decision alone. This government is focused on putting the right frameworks and the right supports in place for all women in New South Wales. Mr Temporary Speaker, in 2013, for the first time in New South Wales, a women's health framework was developed. And this framework focuses action not only within the health system, but also promotes opportunities for the coordination and delivery of New South Wales Government services and programs, which have the potential to enhance the health of all women across this state. The framework focuses on issues where the detrimental health impact is disproportionately experienced by women, or where the response is different for women than for men. The framework places women at the centre of decision-making for their own health and acknowledges women's health is impacted by many factors, including housing, geography, employment and access to services. As health outcomes are influenced by the cumulative effect of a number of social determinants, a life stage approach is used to structure opportunities for enhanced delivery of services and programs. Central to the New South Wales Government's commitment to supporting women's health and reproductive rights are the provision of women's health centres, and the New South Wales Government funds women's health services to deliver services and foster environments which support women in meeting their physical, their social and their economic potential. In New South Wales, women's health centres provide a range of multidisciplinary health services that focus on wellness, on prevention and early intervention, reproductive and sexual health and the effects of violence against women. Together, women's health centres provided more than 133,000 occasions of service in 2015-16. These spanned more than 150 presenting health issues. Mental health, physical health, violence, abuse and relationship concerns are the leading presenting issues at women's health centres in New South Wales. The New South Wales Government is providing the full spectrum of physical and mental health supports for women, both in reproductive health and in postnatal care. Midwives and child and family health nurses in New South Wales play an extremely important role in caring for women. Health services, therefore, are delivered in a variety of settings, including in our homes. Health home visiting is not delivered in isolation, but in fact forms a part of the continuum of care and network of services for families with young children beginning in pregnancy. Comprehensive assessment and coordinated care provide the platform for health home visiting. New mothers may be offered and choose to access postnatal care and support in their home as part of a midwifery continuity of care program following the birth of their baby. Midwives and child and family health nurses work to ensure a seamless transition of care from maternity services to child and family health services, which is particularly important for those families who have been identified with vulnerabilities. Mr Temporary Speaker, the New South Wales Health Maternal and Child Health Primary Healthcare Policy promotes this approach. It identifies a model for the provision of universal comprehensive assessment for all women during pregnancy and after the birth of their infant, and for determining vulnerability and the level of service delivery care required for each individual family. There are particular population groups who benefit, of course, from extra investment in their reproductive and general health, and one such group is Indigenous women. So this government is investing in Aboriginal maternal and infant health services to provide care through, again, a continuity of care model. And under this model, midwives and Aboriginal health workers collaborate to provide a high-quality maternity service that is culturally sensitive, based on primary healthcare principles and provided in partnership with our Aboriginal people. There are over 40 Aboriginal maternal and infant health services sites in New South Wales, delivering services to mothers of Aboriginal babies in over 80 locations. As a government, we also support pregnant women and new mothers with specialist perinatal and infant mental health services, which deliver essential services for the treatment of mental health problems for pregnant women and mothers. Mr Temporary Speaker, this government has committed over $9 million over 3 years to deliver the Mums and Kids Matter program. The Mums and Kids Matter program supports mothers and their young children through short-term accommodation with mental health and parenting care. Mums and Kids Matter is a unique program that fills an important gap in health services for mothers and children. The program delivers family-focused intervention to improve the health and well-being of participating mothers through individually tailored care. Mr Temporary Speaker, the New South Wales Government stands beside women and is committed to supporting their total health needs. We are committing to respecting the rights and opinions of all women, improving gender equality and improving the lives of women across this state.
I'd like to thank the member for Port Macquarie. I call the member for Blue Mountains.
Thank you, Mr Assistant Speaker. I thank the member for Newtown for this motion and reiterate my position once again on comments made by the Minister for Women upon her elevation to the Berejiklian Government's ministry. For my initial effort in discussing a woman's right to choose, BuzzFeed and Huffington Post recorded both my views and the epic eye roll when a male member tried to shut me down. For too many years, we have been fighting for women's reproductive rights and autonomy in the public and private sphere. I want to again note the work of feminists before us here in this place, especially those in the Women's Abortion Action Campaign. Established in 1972, the objectives of this campaign were to establish abortion as a woman's right to choose, the repeal of all abortion laws, free, safe abortions, free, safe contraception and no forced sterilisations. I believe a woman herself is best placed to decide what is best for her. She knows the circumstances around a pregnancy and understands what she needs. She is the one who best knows her own capacity to parent at a particular time and her personal circumstances. It is the woman who should choose to continue or terminate a pregnancy. Of course, that does not make it an easy decision, and many women in that situation will need a lot of support to make the best decision for themselves. I am pro-choice. I am a feminist, and I'm here in this parliament to advance the cause of women. The comments of the Minister for Women that she is personally pro-life are problematic. It is commonly understood in women's politics that the pro-life label is actually shorthand for anti-choice. Long ago, fundamentalist Christian organisations co-opted the pro-life label, and they are very well known for being steadfastly anti-abortion and anti-choice in all circumstances. I strongly believe that people should be very careful about using the term pro-life because its meaning is immediately interpreted to be a description of someone who believes they have the right to make other people's choices for them. Hence my concern with the Minister for Women's statement. Right now, somewhere near a clinic where women are seeking medical advice or a termination, which is never an easy decision, a loud and invasive group of people will be waving placards and hurling abuse, all the while describing themselves as pro-life. However, they are being anti-choice and judgmental. As the New South Wales co-convener of Emily's List, a very proud member of the Labor Party, a feminist here to advance the rights of women, I support the member's pro-choice motion.
Well, the member for Blue Mountains, I call the member from Algoa and Minister for Women.
Thank you, Mr Temporary Speaker, and I'm grateful for the opportunity that the member for Newtown has given me today to publicly set the record straight yet again. This motion makes a number of incorrect assertions about me personally. Unfortunately, it's a motion that's straight out of the Greens playbook. You actually use misinterpretation, and the facts of the whole situation are tossed out the window. So when I saw the member for Newtown's motion, I was actually disappointed, and I was disappointed on a number of fronts. First of all, I was disappointed at the prospect that the 3.8 million women that I represent and that I'm here to serve, including the member for Newtown, and all the women in this House might believe that I do not support a woman's choice to select the best path that is right for her. Secondly, I was disappointed that the member for Newtown's bid, which is to drive a wedge between people in this House, by ignoring the fact that there are different views on this subject matter and different views on reproductive health, and why the member for Newtown thinks it's acceptable to criticise anyone who doesn't subscribe to her personal view is beyond me. But finally, Mr Assistant Speaker, I'm extremely disappointed that the member for Newtown has really no excuse for continuing to misrepresent my views, because I took the time to personally meet with her and explain myself once again. This motion is based on some sort of simplistic notion that because an individual chooses one path for themselves, that they do not support another person's decision for the path that they want to select. To be absolutely clear, as I did tell the member for Newtown before, I respect and support a woman's right to choose the path that is best for her. That decision to seek a termination is an incredibly difficult and deeply personal one, and it's one that I believe should be made safely with medical professionals and all the information that is available at hand to be given to that lady as she makes that decision for herself. Yes, if I, as an individual woman, had to make that choice for my body and my baby, I would do everything within my power to sustain that life within me. Now, you can label that however you want to label it, but that is my choice. And my personal views, as I said on the 30th of January when asked the question, I said personally, I am pro-life, personally. But I've sworn a commitment to all women in New South Wales that I will serve all women in New South Wales, and that is my commitment. My personal views are informed by personal challenges that I've had in order to conceive my own family. The difficulties in conceiving and holding on to those children, it has been my personal journey. But as I also told the member for Newtown, and I've told others, this does not mean that I will stand in the way of any other woman who seeks to take a different path for herself. Every woman in New South Wales has this right today, and I will not be seeking to do anything that would stop a woman from exercising that choice. I, as Minister for Women, I respect and support a woman's right to choose the path that is best for her. And if the member for Newtown seeks to label that as anti-choice, then that is very, very unfortunate. Unfortunately, the member for Newtown wants to polarise this debate on reproductive health into two camps, and it speaks to a lack of understanding regarding the diversity of opinion on these issues. It's divisive and it's also offensive. The member for Newtown, a mother herself, would seek to bring a motion which questions my capacity to represent other women in this state is disappointing. As a Minister for Women, I'm committed to hearing firsthand from all women across this state about the issues that affect them every day and advocating for the rights of women.
I thank the member for Mulgo and Minister for Women. Just before I call the member for Maitland, just resume your seat for a minute, I'd like to point out to the members for Port Stephens and the member for Ballina, they've come into the chamber late. It has been an incredibly respectful debate and every member on both sides has been heard in silence. And I would remind those people who have come to the chamber late that this has been a very respectful debate and I wish it to continue. I now call the member for... Sorry, the member for Maitland?
I'm just wondering, are you going to be...
No, I said both sides. Member for Maitland, I'm not going to get into a debate with you on this. I've said both sides. I've said both sides. If you've been listening, both sides. Well, you've come into the chamber late and you were commenting over the member. There has been no comments across the chamber. I wish you to continue. The member for Miranda. I call the member for... I call the member for Newtown in reply. Oh, well, I call the member for Maitland.
Thank you, Mr Temporary Speaker. And I rise to speak on this motion and I support the member for Newtown for seeking to clarify this advice. Earlier in June this year, I attended a women's consultation which the Minister hosted in Newcastle, and in my response to that consultation, I mentioned that she had got up at the beginning of that and talked about that she noticed in taking on the role of Minister for Women that there had not been enough work in government on women's issues in the last few years, and that she wanted to introduce the first Women's Strategic Plan for New South Wales. Now, for your information, Mr Temporary Speaker, the first female Premier of this state and the member for Strathfield, the former Minister for Women, actually produced a plan for women in 2010. And I think this goes to the heart of the issue, because the Minister can stand in this place and talk about how people have labelled her, but I think we need to say that the issue is really around the clarity of her own communication on this space, because we would always support the right of any woman to make their own personal decision about abortion. But when you're in public office, when you take on the mantle of representing the views of every woman in this space, you need to be very clear of what your position is, and you need to support those choices not just with words but with actions. And what have we seen from this government? We have seen the motion to decriminalise abortion in the other place fail. We have seen the Labor Party having to put forward legislation to stop women in this state being abused and harassed as they enter termination clinics, with some arguing that this is denying freedom of speech and the right to protest. And can I say for the record, as Shadow Minister for the Prevention of Domestic Violence and Sexual Assault, when a woman makes that personal choice to have a termination, walks into that clinic, throwing fake blood on her, shoving pictures of fetuses and praying over her is a form of emotional violence that should not be supported. And what about access to abortion? And that's what I really want to get to here. It's all very well to say you support women's decisions and the path they choose, but if there is no legal choice to do that, if there is no legislation that supports it, if there's no clear pathway, it is just words, and in the Minister's case, fairly sloppy ones at that. They are not free. Women are not free in this state. Abortions are not free. They are not accessible. They're not available for women in their own towns and cities. In fact, just in my electorate of Maitland, the government's proposing a not-for-profit private-public partnership for the new hospital to replace our existing public hospital. The fact is that if that hospital is run by a faith-based provider, that will mean there will be no access to reproductive freedom rights, because a faith-based provider will choose, as they have in other jurisdictions, not to provide access to free and safe abortions. So that is actually going against what the Minister's saying. It's not just about words, it's about actions, it's about what you deliver. We know there are inequities for women in this state in accessing contraception and termination services, and while the law lags behind public perception, the services are not provided, and women, and in some cases girls, are left to care for babies that they did not choose to have. And this Minister needs to stand up for those, to be clear in every conversation that she is speaking for the government as a government minister, not on her own personal reconnaissances.
I'd like to thank the member for Maitland. I call the member for Camden and Government Whip.
Thank you. Thank you, Mr Acting Speaker. Look, I rise today to speak on this motion brought by the member for Newtown. Just want to ask everybody to just all be very, very clear on what has been said and is being said. And I just must pick up on the member for Maitland's starting and finishing about the minister being clear. The minister stood up pre the member for Maitland and was extremely clear. Hansard will enunciate that, I'm sure, in the morning. And that clarity is that regardless, every single member in this place has a personal opinion about every single issue. That's the nature of being an individual. It's the nature of being what we do. And our lives have shaped those opinions. That does not, under any circumstance, take away from the minister's ability to look after the welfare of each and every woman that comes under her guise as the Minister for Women. And I just want to make the point, please, on a personal level. One of the things today is we are not debating, we support the right of women to make a choice. Well, I absolutely do. Acknowledge the widespread community support. Absolutely. You have mine. Calls on the minister to clarify her position. She has done that, and she has done it abundantly clear. And I think that position is she, like every other member, has things that have influenced her decisions in all of her decision making. However, it will not, under any circumstance, influence her role to do her job in nothing but a professional manner. And on a personal level, I want to just say on record in the House that the Minister for Women, member for Mulgoa, is an extremely caring, compassionate, professional member, one that I consider a very good friend, and one that I know has my total support and the total support of the government in doing her role in what she believes will be the best for women, for them to be able to have their choices adhered to, their preferences adhered to, and what they believe to be best for them within the realms of the law. And I just want to acknowledge that the Minister is extremely caring, extremely professional, and has my total support and respect in this. So we are here today. I think we're all on all sides in support of a number of the points in this motion. However, not under any circumstance, I'm not supporting any criticism unjustly at a minister that would not allow her to A, have an opinion, as we all do, but B, then goes on to insinuate she does not or will not have the ability to make fair and proper decisions. So that's my contribution.
I want to thank the member for Camden. The member for Balmain is seeking leave.
Yes, just to make
is leave granted?
Mr. Temp.
No, leave.
I just want to amend that. No, amend it.
If you go on.
Mr. Temporary
Leave's
Speaker,
granted.
in light of the comments raised by the Minister and others, I'd like to propose that we replace everything after that. I give notice tomorrow, I shall move that, and replace everything after that with this House, with the support for the right for women to make the choice that is right for them, which includes respecting their right to access safe legal abortion. Thank you.
The question is that.
Sorry.
The member for Balmain. The question is that the amendment by the member for Balmain be agreed to. All those opinions say aye. Sorry. Just resume the seat for a second. I'll just seek discussion for the clerk. Okay, I've sought advice from the clerk. We will obviously deal with the amendment at the end of this motion. Yep. So the member for Summerhill is seeking leave. Is leave granted? Leave is not granted. Leave is not granted. The member for Summerhill, resume your seat. I call the member for Newtown in reply.
Thank you, Mr. Speaker. Thank you, Mr. Speaker, and I would like to thank everybody for their contribution to this debate, the member for Port Macquarie, Mulgoa, Blue Mountains, Maitland, Camden, and thank my Greens colleague Jamie Parker, the member for Balmain, for seeking leave and making an amendment to the motion. I would like to acknowledge that the member for Summerhill did try to make a contribution and express my disappointment that she was denied the ability to make a contribution. I think we've seen here the willingness to have a respectful debate and want to put the actual issue that is before this chamber for discussion, and I think it is shameful that we have seen the member for Summerhill be denied the opportunity to be able to contribute. We have moved an amendment and accepted the minister's contribution as a suggestion that she is actually pro-choice, that she does support a woman's right to make a choice that is right for her. I then would expect that we will see this whole chamber join together and support this amended motion that recognises that a woman should be able to have access to safe, legal abortion in this state, and I would hope that we would see the Minister for Women supporting that motion, because from what we just heard, if that is actually the case, while she may make personal choices, and I appreciate it's not necessary for her to put her personal choices on the record, what we're talking about here is for women across this state to be able to access safe, legal abortion. That was what was at the heart of our concern when we introduced this motion in the first place, that we thought we had a Minister for Women, and as was articulated by the member for Blue Mountains, when you say you are pro-life, that suggests that you are anti any woman being able to make a choice. I think what we heard today is a clarification on that. What we heard today, I think, was the government recognising that they support a woman's right to choose, that they support a woman to be able to access safe, legal abortion. If that's the case, then can I just say that I am not playing politics with this. I would love to see this chamber support the right for a woman to choose. I would love to see, in a couple of minutes, for this chamber to unite and say we recognise that a woman gets access to safe reproductive health choices in this state, and we all in this chamber support a woman's right to choose and a woman's right to access safe, legal abortion. I had no interest in condemning the Minister for Women in this motion. I don't want to play politics with it, and as we have shown, we have amended the motion to remove the Minister for Women out of it because we actually wanted to focus on a woman's right to choose. If the Minister for Women supports a woman's right to choose, if she recognised that a woman should be able to make that personal choice for herself, then I would hope that the government will join with everybody else on this side of the House and support that in this chamber today. Why does it matter? It matters because the choice to have a termination is something that is a very personal choice. The choice to terminate a pregnancy is huge. It should not be for any of us in this place to tell a woman or put any barriers in place for a woman who is making that tough choice. Instead, we should be facilitating medical professionals, health professionals and support services to support that woman in the choice that she needs to make. I urge all members to not look at their conscience on this, not listen to their conscience on this, but empower women to listen to their own conscience when they make the choice to be able to access safe, legal abortion in this state.
I'd like to thank the member for Newtown for her contribution. The original question was that the motion, as moved by the member for Newtown, be agreed to, upon which the member for Balmain has moved, that they replace everything after that this House with support for the right for women to make the choice that is right for them, which includes respecting their right to access safe legal abortion. The question is that the amendment be agreed to. All those opinions say aye. Aye. Against? And the ayes have it. The ayes have it. The question is that the motion amended by the member for Balmain, for the member for Newtown, be agreed to. All those opinions say aye. Aye. I'll read that again. I'll just clarify that. The question is that the amended motion from the member for Newtown be agreed to. All those opinions say aye. Aye. Against? I think the ayes have it. The ayes have it. Yeah.